Did you know that your feet might be trying to tell you something? Something that could save your life? Last month I received a letter from Margaret, a 76-year-old widow from Ohio. She wrote to me about her husband, James. "He was always so active," she said. "He played golf 3 times a week, gardened every weekend, and never complained about his health. But then I noticed his feet changing. The skin looked different. There was swelling that wouldn't go away, and he developed sores that just wouldn't heal. I begged him to see a doctor, but he insisted it was just normal aging. 6 months later, he was gone. Heart failure. The doctor said the signs had been there for months, literally written on his feet." Stories like Margaret E's are why I am making this video today. Your feet aren't just what you stand on. There are windows into your overall health, especially after 70. The truth is, dangerous symptoms can appear in your feet up to 3 years before major health events like heart attacks, strokes, or even death. And sadly, 97% of seniors miss these critical warning signs, dismissing them as just another part of getting older. But they are not. Your feet contain over 7,000 nerve endings, 26 bones, and a complex network of blood vessels that can reveal what is happening throughout your entire body. When something goes wrong inside, your feet are often the first to show it. In this video, we are going to cover 5 critical foot symptoms that you should never ignore after age 70. These aren't just minor inconveniences. They could be life-saving warnings. By the end of this video, you will know exactly what to look for, what each symptom might mean, and most importantly, what actions to take if you spot these changes. Stay with me until the end, because the 5th symptom is something most seniors and even many doctors overlook. Yet it is often the clearest indicator of a life-threatening condition that might be just months away. If you are finding this information valuable so far, please take a moment to hit that like button and comment "feet" below so I know you're following along. Your engagement helps this potentially life-saving information reach more people who might need to hear it. Now let us dive into the first warning sign that your feet might be sending you. Symptom number 1. Persistent swelling that won't go down. One of the most commonly missed yet dangerous foot symptoms after 70 is persistent swelling that doesn't resolve with rest or elevation. This isn't the occasional puffiness after a long day of walking or sitting. It is swelling that stays day after day, making your shoes feel tight and leaving indentations in your skin when you press on it. Many seniors like Robert, a 72-year-old retired teacher I spoke with, assume this is just part of aging. "My ankles were swollen for months," he told me. "I figured it was normal. Everyone my age complains about swollen feet. I bought looser shoes and just lived with it." What Robert didn't realize was that his swollen feet were actually an early warning of congestive heart failure. His heart wasn't pumping efficiently enough to move fluid through his body, causing it to pool in his feet and ankles. Here is what happens. When your heart begins to weaken, it can pump blood as effectively throughout your body. Gravity naturally pulls fluid downward, which means it accumulates in the lowest parts of your body, your feet and ankles. As this fluid builds up, it causes swelling, known medically as edema. This isn't just uncomfortable. It is your body literally waving a red flag that your heart is struggling. Even more concerning, this kind of swelling can appear up to 3 years before a major cardiac event. It is often subtle at first. Maybe your socks leave deeper marks than usual, or your shoes feel tighter in the evening. But over time, it persists and worsens. What makes this symptom particularly dangerous is how easy it is to rationalize away. Many people attribute it to the heat, to sitting too long, to eating too much salt, or simply to getting older. While these factors can cause temporary swelling, persistent swelling that doesn't resolve with elevation and rest demands medical attention. So what should you do if you notice this symptom? First, track when the swelling occurs and how long it lasts. Is it worse in the evening? Does it improve overnight? Does elevating your feet help at all? This information will be valuable to your doctor. Second, check for pitting edema. Press your finger into the swollen area for 5 seconds, then release. If the indentation remains for several seconds, that is called pitting edema, and it is a stronger indication that something serious might be happening. Third, schedule an appointment with your doctor specifically to discuss this symptom. Ask directly, Could this swelling be related to my heart health? Often, a simple echocardiogram or blood test can detect early signs of heart failure when it is still very treatable. Remember Robert, after finally seeing a cardiologist, he was diagnosed with early-stage heart failure. With medication, dietary changes, and a monitored exercise program, his condition stabilized. 3 years later, he is still enjoying an active life with his grandchildren, all because he eventually addressed that harmless swelling in his feet. Don't wait until breathing becomes difficult or chest pain develops. The warning signs in your feet could give you years of advance notice, but only if you pay attention to them. If you are still watching and finding this information valuable, please type swelling in the comments below to let me know you are paying attention. Now, let us move on to the next critical symptom. Symptom number 2, changes in skin color and temperature. The second warning sign that could save your life is changes in the color and temperature of your feet. After 70, many seniors experience feet that turn unusually pale, bluish, or even reddish purple. Sometimes one foot might be a different color than the other, or parts of your foot might be cooler or warmer to the touch than the rest. These changes are not just cosmetic. They are potential indicators of dangerous circulatory problems that could lead to heart attacks, strokes, or even gangrenous infections requiring amputation. Let me tell you about Eleanor, a 75-year-old grandmother who noticed that her right foot had started looking paler than her left, especially when she elevated her legs. She also felt that it was cooler to the touch. So I figured it was just poor circulation from sitting too much, she told me. I tried massaging it and wearing warmer socks. But what Eleanor was actually experiencing were symptoms of peripheral artery disease, PAD, a condition where the arteries that supply blood to your limbs become narrowed by the same kind of fatty deposits that cause heart attacks. Here is what happens. When arteries narrow, less blood reaches your extremities. With reduced blood flow, your feet receive less oxygen and nutrients, causing changes in color and temperature. Pale or bluish feet generally indicate decreased arterial flow, while reddish-purple feet, especially when hanging down, might indicate that blood is flowing in but struggling to flow out, a problem with your veins. Both conditions are serious because the same process happening in your feet is likely happening elsewhere in your body, including the arteries that supply your heart and brain. In fact, people with peripheral artery disease have a 6 to 7 times higher risk of heart attack or stroke. The temperature changes are equally important. Cold feet, especially if one foot is noticeably colder than the other, can indicate a significant blockage. If left untreated, severe blockages can lead to tissue death, gangrene, which sometimes requires amputation. The most dangerous aspect of this symptom is that it often doesn't hurt. Unlike chest pain, which most people recognize as an emergency, changes in foot color or temperature can be subtle and painless until the condition is quite advanced. So what should you do if you notice these changes? First, perform a simple check. Elevate your feet for 2 minutes, then hang them down. Watch how quickly color returns. In healthy circulation, any paleness from elevation should quickly return to normal when lowered. If color returns very slowly or your feet turn an angry red when lowered, that suggests circulatory problems. Second, compare both feet. Are they the same temperature, color? Does one foot turn pale when you elevate your legs, while the other stays pink? Differences between feet are particularly concerning. Third, don't wait to see a doctor. Request an ankle brachial index test, a simple, non-invasive procedure that compares the blood pressure in your ankle to the blood pressure in your arm to detect circulation problems. In Eleanor E.'s case, she finally mentioned the color change to her doctor during a regular checkup. Test revealed a 70% blockage in the arteries supplying her right leg, and subsequent tests found similar blockages in one of her coronary arteries. With medication, lifestyle changes, and a minimally invasive procedure to open the blocked artery, Eleanor avoided what could have been a devastating heart attack or stroke. The key is not to dismiss these changes as just another sign of aging. Your body is giving you valuable warning signals, potentially years before a life-threatening event. If you are still following along and finding this information valuable, please comment "circulation" below to help others find this important information. Now let S move on to symptom number 3. Symptom number 3. Slow healing wounds or persistent sores. The third critical warning sign is wounds on your feet that heal slowly or don't heal at all. After age 70, many seniors develop small cuts, blisters, or sores on their feet that seem minor at first. But when these wounds take weeks to heal or never fully close, it is not just an inconvenience. It could be signaling a life-threatening condition. Consider William, an active 78-year-old who noticed a small cut between his toes after a day of gardening. "I cleaned it and put on a bandage just like any other cut," he said. But 2 weeks later it hadn't improved at all. In fact, it seemed to be getting worse. What William didn't realize was that this slow healing wound was a warning sign of undiagnosed diabetes, a condition that would soon threaten not just his foot, but his life. Here is why this happens. Your body has an amazing ability to repair itself, even as you age. A small cut or blister should start showing improvement within days and be well on its way to healing within a week or two. When wounds linger or worsen, it typically indicates one of 3 serious problems: poor circulation, diabetes, or a compromised immune system. In the case of diabetes, elevated blood sugar damages both blood vessels and nerves. The damaged blood vessels can deliver enough oxygen and nutrients needed for healing, while nerve damage means you might not even feel the wound worsening. This dangerous combination allows small injuries to become infected, potentially leading to serious complications, including amputation. Poor circulation, often from heart disease or peripheral artery disease, similarly prevents wounds from receiving the blood flow they need to heal. And a weakened immune system, whether from age, medication, or underlying illness, can fight off the bacteria that inevitably enter through breaks in the skin. What makes this symptom particularly dangerous is that foot wounds often hide between toes or on the bottoms of feet, where they're easy to miss, especially if you have mobility issues that make checking your feet difficult. By the time they're re-noticed, infection may have already set in. So what should you do if you discover a wound that isn't healing properly? First, don't try to treat persistent wounds yourself. Home remedies like peroxide, alcohol, or over-the-counter antibiotics aren't sufficient for wounds that haven't improved within a week. Second, see a doctor immediately, preferably a podiatrist or wound care specialist. Be sure to mention how long you've had the wound and any changes you've noticed. Ask directly about testing for diabetes if this hasn't been done recently. Third, while waiting for your appointment, keep the wound clean with mild soap and water covered with a sterile bandage and elevated when possible. But don't delay seeking professional care. Wounds that haven't improved within a week need medical attention. For William, that persistent cut led to a diagnosis of type 2 diabetes with blood sugar levels dangerously out of control. With proper treatment for both the diabetes and the wound, he avoided amputation, but his doctor told him he'd caught it just in time. Had he waited even a few more weeks, he might have lost his foot or worse. Remember, wounds that heal slowly are never normal, even in advanced age. They rule your body as a way of alerting you to serious underlying conditions that need attention now, not later. If you are finding this information helpful, please comment "healing" below to help others discover this critical health information. Now, let us continue to our 4th symptom. Symptom number 4. Numbness, tingling, or burning sensations. The 4th warning sign that should never be ignored is numbness, tingling, or burning sensations in your feet. Many seniors experience these feelings and dismiss them as just another uncomfortable aspect of aging. But these sensations, sometimes described as pins and needles, electric shocks, or a feeling that you are wearing invisible socks, can actually be early warning signs of serious neurological or circulatory problems. Take Martha, a 73-year-old retired nurse who started experiencing numbness in her toes that gradually spread to the balls of her feet. "I thought it was just part of getting older," she told me. "I figured I'd lived on my feet for 40 years as a nurse, so some numbness was to be expected." What Martha didn't realize was that this numbness was actually an early warning sign of a small stroke. The same circulatory issues affecting her feet were also affecting the blood vessels in her brain. Here is what is happening when you experience these sensations. Your peripheral nerves, the network that carries information between your central nervous system and the rest of your body, are sending distress signals. These nerves can be damaged or impaired by many conditions, including diabetes, vitamin deficiencies, circulation problems, or even the early stages of neurological disorders. Numbness is particularly concerning because it means you've lost protective sensation. Without the ability to feel properly, you might not notice injuries, extreme temperatures, or pressure points that can lead to serious wounds. Many foot amputations begin with an injury that wasn't felt due to numbness. Tingling or burning sensations, often called neuropathy, frequently indicate nerve irritation or damage. While sometimes temporary, persistent, or worsening tingling should never be ignored. It could signal the early stages of diabetes, nerve compression from spine problems, or even early warning signs of a stroke or other neurological event. What makes these symptoms especially dangerous is how easily they are dismissed. Many people assume they are inevitable with age or attribute them to minor causes like sitting too long or wearing tight shoes. But when these sensations persist or worsen, they demand medical attention. So what should you do if you're experiencing numbness, tingling, or burning in your feet? First, note exactly where the sensation occurs, when it started, whether it is constant or comes and goes, and if it is getting worse. This information will be crucial for your doctor. Second, check your feet visually every day. Since you can rely on feeling, you need to use your eyes to spot any injuries, redness, or swelling that might otherwise go unnoticed. Third, see your doctor promptly. Be sure to mention any other symptoms you may be experiencing, even if they seem unrelated. Something as simple as recent dizziness or momentary vision changes combined with foot numbness could indicate a serious neurological issue requiring immediate attention. In Martha E.'s case, her doctor recognized the combination of her foot numbness and occasional dizziness as warning signs of transient ischemic attacks, TIAs, mini-strokes that often precede a major stroke. An ultrasound revealed significant narrowing in her carotid artery. With proper medication and monitoring, Martha avoided what could have been a devastating full stroke. Never accept numbness or unusual sensations as just part of getting older. Your nervous system is sophisticated and complex. When it sends these signals, it is telling you something important about your health. If you are still with me and finding this information valuable, please comment nerves below. And now, let us move on to our fifth and final symptom, the one that most people and even many doctors miss entirely. Thiassum symptom number 5, changes in the appearance of toenails and skin texture. The fifth and perhaps most overlooked warning sign is changes in your toenails and the texture of your foot skin. After 70, many seniors notice their toenails becoming thicker, more brittle, or changing color. Similarly, the skin on their feet might become unusually thin, shiny, or lose its hair. These changes are frequently dismissed as cosmetic issues or normal aging, but they can actually be vital clues to serious underlying health conditions that could threaten your life. Let me tell you about Harold, an 81-year-old who noticed his toenails becoming increasingly thick and yellow. At the same time, the skin on his feet became smooth and shiny, and he realized the hair on his toes and the top of his foot had disappeared. "I just thought it was an age thing," he said. "I even joked with my wife that at least I didn't need to worry about hairy toes anymore." What Harold didn't know was that these changes were actually warning signs of severe peripheral artery disease, the same condition that would lead to his heart attack just 6 months later. Here is what happens. Your toenails and skin require good circulation to stay healthy. When blood flow is reduced, whether from heart disease, diabetes, or other circulatory problems, your body prioritizes vital organs over extremities. As a result, your feet receive less oxygen and nutrients, causing visible changes to your nails and skin. Thickened, discolored toenails might look like a fungal infection, and sometimes they are. But they can also indicate poor circulation or underlying systemic diseases. Similarly, thin, shiny skin without hair suggests blood is not reaching your feet properly. The hair follicles and skin cells simply can't survive with inadequate blood supply. What makes this symptom particularly dangerous is how subtle and gradual it can be. Most people don't pay close attention to their toenails or notice when the hair on their feet thins out. Even worse, many doctors don't routinely examine patients' feet during checkups, missing these critical warning signs. So what should you do if you notice these changes? First, don't assume nail changes are just fungal infections. While fungal infections are common, have a doctor confirm this diagnosis rather than just treating with over-the-counter medications. Second, check for other circulatory symptoms. Are your feet cold? Do they change color when elevated? These additional signs strengthen the case for circulatory problems. Third, specifically ask your doctor to check your foot pulses. The strength of the pulses in your feet can tell your doctor a lot about your circulation. If they are weak or difficult to find, further vascular testing may be necessary. For Harold, these seemingly minor changes might have saved his life if he'd recognized their significance. After his heart attack, doctors discovered severe blockages in several arteries, the same blockages that had been slowly reducing blood flow to his feet for years before affecting his heart. Remember, your body is remarkably good at adapting to gradual changes, which means serious conditions can progress quite far before causing obvious symptoms like chest pain or shortness of breath. Your feet, however, tend to show signs much earlier if you know what to look for. If you're still with me and finding this information valuable, please comment nails below to help others discover this often overlooked sign of potential heart problems. We've covered 5 critical foot symptoms that could be warning you of serious health issues: persistent swelling, changes in skin color and temperature, slow healing wounds, numbness or tingling, and changes in toenails and skin texture. Any one of these signs deserves attention. Multiple symptoms demand immediate medical care. Remember Margaret from the beginning of our video? She told me something I'll never forget. If I had known what James's feet were trying to tell us, he might still be here today. We had the warning signs for almost 2 years, we just didn't know how to read them. I don't want that to be your story or the story of someone you love. So here is your action plan. First, make foot checks part of your daily routine. It takes just 30 seconds. Look at your feet each morning when you put on your socks or shoes. Check between your toes, look at the color of your skin, and examine your nails. Feel for temperature differences between your feet or areas of numbness. Second, create a baseline. Take clear photos of your feet now when you re-healthy so you will notice changes more easily. Make notes about any current symptoms to track whether they improve or worsen over time. Third, don't dismiss foot symptoms as just aging. Yes, some changes come with age, but persistent swelling, numbness, color changes, slow healing wounds, and significant nail or skin changes are never normal at any age. Fourth, bring up foot symptoms at your next doctor's appointment, even if that's not what the appointment is for. Many physicians don't routinely check feet unless you specifically mention concerns. Be your own advocate. Finally, remember that prevention is always better than treatment. Stay active to promote good circulation, maintain a healthy diet to prevent diabetes and heart disease, wear proper footwear to avoid injuries, and keep your feet clean and dry to prevent infections. Your feet literally support you through your entire life. Now it is time to pay attention to what they were trying to tell you. They might just be saving your life. Thank you for watching this important video. If you found it valuable, please give it a thumbs up, share it with someone you care about, and subscribe to our channel for more potentially life-saving health information. Remember to turn on notifications so you never miss our new videos. And if you have experiences with any of these symptoms or questions about foot health after 70, please share them in the comments below. Your story could help others recognize these warning signs before it's too late. Until next time, take care of your feet. They're taking care of you.